Hi, I'm Dr. Mindy Benton, and I'm an ABFAS board certified surgeon. Today, I'll be sharing the steps to becoming board certified through ABFAS, as well as highlighting a few helpful tips for candidates getting started or for those at any point along the way in this important process. There are several reasons to become board certified. Patients prefer seeing a board certified physician because of the high level of personal credibility that certification provides. In fact, many hospitals and insurance companies now require physicians to have specialty board certification, and some require physicians to obtain certification within their first 5 years. In addition, many large medical groups require certification in order to become a shareholder. So it's not really a question of should you get certified, but when and how you get certified. Here at ABFAS, we're proud to be known for the integrity of our exam process and to be the only JCRSB recognized foot and ankle surgery certification board in the industry. And we're thrilled that you're here and interested in learning more. Congratulations on taking your first step towards your new future. So, you might be asking yourself, what exactly is board certification? Well, there are two parts to board certification: board qualification and board certification. Part 1, or board qualification, ensures that a foot and ankle surgeon has successfully demonstrated cognitive knowledge of foot and ankle surgery. Part 2, or board certification, goes one extra step. It ensures that you not only successfully demonstrate book knowledge, but that you have the clinical skills necessary to be a foot and ankle surgeon. So let's start with Part 1, or board qualification. First, you must obtain a doctorate of podiatric medicine. Once you successfully finish medical school, you'll need to complete your podiatric medicine and surgical residency. There are 2 levels of residencies, each leading to a slightly different outcome. Most every residency program now is a PMSR or PMSR with the added RRA credential. Once you've received your doctorate degree and completed a residency program, you can take the Part 1 examination. This exam is comprised of a multiple-choice didactic exam, as well as a computerized-based patient simulation, or CBPS. Once you've passed both exams and provide ABFAS with your residency completion certificate, you become ABFAS board qualified. Part 2, or board certification, is a 3-step process. Step 1, log your cases onto our Podiatric Logging Service, or PLS. Start this step as soon as you finish your residency program and begin performing surgery, as you'll need a minimum of 65 foot cases and 30 RRA cases before you can proceed forward. And if you think you can wait until the last minute to log your cases, let me tell you otherwise. At ABFAS, we audit every log to ensure that our candidates have completed the proper surgical experiences. So my suggestion is to allot a few minutes per day to log your cases properly through PLS. At the end, you'll be happy that you did. Once you've logged at least 65 foot cases and 30 RRA cases, you're ready to move to Step 2. Step 2 consists of a rigorous case review process. ABFAS randomly selects 13 foot surgery cases and/or 13 RRA cases from your PLS logs for evaluation. We'll contact you and ask that you complete documentation on those selected cases. A committee of ABFAS certified foot and ankle surgeons will review your case documentation. The final step consists of another computer-based patient simulation exam. This exam takes place at a local testing center. Once you successfully complete the case review process and pass the exam, as well as submit proof of hospital privileges and your state license, you become board certified by ABFAS. But if at first you don't succeed, just try again. You have 7 years from the time you become board qualified to obtain board certification. Now, for some helpful tips. Log all of your cases on PLS. ABFAS will closely audit all logs to ensure that candidates have had the proper surgical experiences and that your PLS records match the hospital records. Candidates who fail to log all cases will not be able to submit materials for review and will be required to reapply the following year. And make sure your progress notes are complete. You'll need the necessary radiographs as described in the requirements document, which you can find right here. This document will also specify how you can upload your images in the correct format. As a matter of fact, you should read everything in the requirements document, as it clearly states all the details pertaining to board qualification and board certification. Again, you can find that document online by visiting here. Another helpful tip is to take our practice tests using the computer-based patient simulation examples on our ABFAS website. Familiarize yourself with the test process and practice 15 minutes per case. Now, let's answer some frequently asked questions. CBPS is a candidate-driven process that presents a case for you to analyze and apply what you have learned. Candidates drive the exam by performing actions to collect and analyze data for problem solving for a given case scenario. Remember, be sure not to overselect or shotgun diagnostic or treatment options. Multiple incorrect or unsafe tests selected on our CBPS exam could negatively impact your score. This is no different from a real patient encounter. Treatment includes complete perioperative management of the patient before, during, and after surgery. When completing the CBPS case, don't forget to include the management of medical comorbidities. It's important that you keep track of important radiographs or case documentation. Make sure you have access to all your clinic notes and imaging studies. But if you don't have everything, submit all the materials you do have, and the case will be scored accordingly. You can still earn credit for the indications and management of the patient. Your score is based on the information you provide. Complications are a known surgical risk. It is important to document both the complications and the steps taken to address it in your progress notes. Include all additional materials if any subsequent procedure is performed. It is important to log cases correctly on PLS. ABFAS will review and score a case in the category in which you originally logged it. Yes, you can. If you are a surgeon of record on the operative reports and anesthesia record, and if you are involved in patient care before and after surgery, as found in the progress notes, then these fellowship logs will suffice. If you didn't pass one of the components of the Part 2 test, you will receive credit for the passed portion of the exam and may repeat the failed section as long as your window of eligibility is open. Credit for a passed exam lasts 7 years, or as long as your qualification period lasts, whichever comes sooner. Just reapply the following year. Continue to log all additional cases in the meantime and complete your hospital audit. And if you have any further questions, please visit our website. It's my hope that you now better understand the process of becoming board certified with the American Board of Foot and Ankle Surgery. Please feel free to reach out should you need any further assistance. We're always here to help you. Thank you.